Hello and welcome. UVA Speaks is a podcast of Lifetime Learning, a division of the Office of Engagement at the University of Virginia. Lifetime Learning brings the knowledge and expertise of UVA's faculty to the university's alumni, friends, and families. My name is Susan Lynch, and I am the Associate Director of Lifetime Learning at the University of Virginia's Office of Engagement. This podcast features Kirsten Gelsdorf, a professor of practice of public policy and the Director of Global Humanitarian Policy at the Batten School of Leadership and Public Policy at the University of Virginia. At Batten, Gelsdorf co-directs the UVA Humanitarian Collaborative, a research initiative bringing together scholars, global practitioners, and students to develop research and policy supporting the needs of vulnerable populations caught in humanitarian crisis. Professor Gelsdorf brings almost 20 years of experience working in the humanitarian sector to her teaching and scholarship at UVA. In this podcast, Professor Gelsdorf will speak with us about current humanitarian crises in the world today. So thank you, Professor Gelsdorf, for speaking with me today.
Thanks so much, Susan. I'm so glad to be here.
So first, I'd like to start off with a broad discussion. And so across the world, how many people are in a humanitarian crisis, and sort of where are those locations across the world? And I think it's important to have that broad understanding and scope of the problem.
Yeah, I think a lot of people, when they hear global humanitarian crisis, you think emergency, you think short term, you think one-off. But the reality today is that there are around 1 in 29 people around the world who are actually caught in a humanitarian crisis at the scale and complexity of what we're seeing in Ukraine, right? So there's 69 different countries around the world that currently have a global humanitarian response happening within that. So in addition to that, of course, there's the floods that we see in the United States. So I'm not counting those. I'm not counting the wildfires, right? I'm not counting a lot of crises that are happening in places like China where they don't ask for a global response. So this is actually even a kind of a subsection of what humanitarian need is around the world. And so while I think in the past we used to think of humanitarian aid as this kind of bespoke or smaller population of need, it actually is something that is affecting people all over the world in all different ways. So those 69 countries, I think today, of course, we all think about Ukraine, and that's clear. But I think even if we just think back a little bit, right, there's the needs in Afghanistan, there's the needs in Syria. Some of the listeners may be following what's happening in Yemen or Ethiopia, but there's also, the typhoons in the Philippines. There's massive famine and food insecurity in Somalia. There's the response to Lebanon is still happening. Remember, there was the explosion in Beirut in the port, and that's not even counting the pandemic, right? Which I think we all know also created, humanitarian needs. And by humanitarian, I mean really these kind of life-saving, life assistance needs that many people are caught in different ways. And I think looking ahead a little bit, we're going to continue to see, of course, conflict type environments and also, of course, disasters as we see the impacts of climate change. But there's also massive displacement crisis, right? That displacement that will be driven both by conflict and by climate-induced displacement. And so that's going to create different humanitarian need trajectories, not only for the people who are on the move, but also for where those people end up, right? All of a sudden, if your population is 25% more than it used to be, that's a strain on different resources and basic social services that create humanitarian needs in new ways also.
Thank you. That really puts it into an understanding, and it is such a broad and deep need. So with so much need, so when a situation like the war in Ukraine erupts, and in a span of weeks, where there are millions of people displaced from their homes amid violence and war, what are the humanitarian organizations that are deployed and that are on the ground immediately, and then as the crisis continues to evolve?
Yeah, so humanitarian response it's interesting because it's like, what does it actually look like, right? So maybe just kind of breaking apart Ukraine a little bit. I think if we think about Ukraine, right, I think a lot of the media coverage is looking really at the East, where we have these, we have extreme violence, you have casualties, right, which meaning both, people getting injured and people dying because of fighting. And, I think where most of your listeners are probably aware of, people being trapped in places and so needing to be evacuated, right? But there's also kind of just the breakdown of electricity, water and sanitation, health support, and all of those needs. So in addition to the risks of kind of active fighting, there's what, where and how we kind of can protect people and help them get to safety. But in Ukraine, then there's also kind of the central part of the country where people are kind of coming and going, right? You also now have mostly only female-headed households in different places, as many of the men are fighting. And then, of course, in the West, you have populations who are hosting many families, right? So it's estimated that up to 8 million people are internally displaced, meaning 8 million people inside the country have left their homes and are now in other places in Ukraine. And so kind of like I mentioned earlier, that of course creates classrooms that are now tripled in size, or different needs, right, that people have when they're pulled out of their homes with very short notice. They don't necessarily have access to their support systems in the way that they used to. Then in Ukraine, you have the border. So you have what's happening on the border, right? So when people cross the border, what are the rights? What is the information? How can they be assisted best to get somewhere where they can, safely live? And we don't know, right? Temporarily or longer term, which are questions, right? Where can my kids actually enroll in school? Where can I get, healthcare? Where communication networks? Where do I have access to financial networks and things like that? So those are all kind of questions. And then once people actually get to somewhere, again, where are they living and what kind of assistance are they getting? And so I think that within that, the humanitarian system is kind of doing so many different types of activities, from the most hardcore kind of immediate, how do we protect the lives of civilians caught in conflict and how do we get them out safely, to how do we support, 1 in 3 people in Ukraine is now estimated to be food insecure, meaning that they have really significant food insecurities that could be life-threatening for them. So how are we getting food to all of those people in addition to medical care? And that number is across the country, right? So of course it's concentrated more in the East, but these are needs everywhere. So, right, the UN is thinking about how do we do food distribution, and how are we even assessing what the needs are? So that's something else that this United Nations and humanitarian system does on a daily basis, is trying to assess what are these needs that need to be addressed, and then who is best placed to address them. So where and how, first and foremost, always can the government assist, whether at the national or regional or local level? What is the local non-governmental and volunteer communities doing, and how can we support what's already happening at the local level? And then where is kind of international capacity needed to kind of supplement and support those efforts? So, but it's really broad. I think a lot of people think of humanitarian aid as, food delivery, a bag of food, but really it's this much wider spectrum of activities that are needed.
Yeah, thank you. So how many organizations would you think, or do you know, that are deployed in something like this? I mean, how many are we talking about?
So I haven't looked at the latest, the UN appeal right now, but it's in the hundreds, right? Usually. So again, it's who are we counting? I think, right. So one thing that the UN does when a crisis happens like this is it launches something called a humanitarian response plan. And sometimes those plans have different names, but what it is it's not just a product, it's actually a whole process, right? So the idea is, once the government says, a sovereign government says, yes, we would love international aid to come in, we would like your assistance, then together, depending on what the situation is with the government, right? A Syria situation is very different than a Ukraine situation in terms of the national government versus Yemen versus South Sudan versus, right? So there's all different levels of how and where international assistance is kind of coordinated. But in general, the hope is that always these things are government-led when they can be. So first thing that happens is, the core UN agencies and larger non-governmental organizations and Red Cross societies and systems will get together. And that can be, 30 organizations, right, or more. So, CARE, Save the Children, Oxfam. We actually have some incredible UVA alumni who have led these organizations, right? Carolyn Miles led Save the Children. And so, actually, I would say that there's who's everywhere in these different organizations, which is really exciting for someone like me. And I'm hoping that through my work, we're getting more even engaged in this field. But so there's the UN, there's the non-governmental organizations. And the UN, remember, it's the refugee agency, UNHCR, or the World Food Program, who won the Nobel Peace Prize last year, or UNICEF. Maybe some of your listeners remember collecting money on Halloween for that organization that has the mandate for women and children. So, it really, there's the World Health Organization we all heard about last year during COVID, right? So there's all these agencies with different mandates that really kind of look at what basic social services mean for people. So they all come together. So all these groups come together and they say, okay, what are the needs? How many people are in need, right? Doing the estimate, figuring that out. And then the next step is setting the priorities. So what can you actually achieve over the next 6 months? Humanitarian appeals are generally, we only get, and I'm going to use the we because I'm still part of the system, 40% of the funding that's asked for. So you need to be really strategic, and it's kind of a triage system, right? It's not, you have to make a series of trade-offs. So the questions come in as to what are the government's priorities and what do people most need and what is sustainable, like what in terms of activities, and how can people be helped the best, most efficiently and effectively. And so then those strategies are set kind of, if it's shelter, or is it protection of people? Is it food assistance, or is it, breaking down discrimination, right? And throughout those crises that I mentioned before in those 69 countries, like the Nepal earthquake had a lot in it about discrimination and different issues about like trying to see how equity and equality could be brought into the response, given the historical construct there of society. Whereas in Yemen, it's really more about access, right? Making sure, can we actually get to the people who need it? Because that's a bigger challenge, versus after the tsunami in Indonesia, it was about shelter reconstruction, right? So it's like, what are the priorities in Ukraine? And then after the priorities are set, it's about coordinating all of these actors. Who's going to do what? How do we avoid duplication? How do we work together where we need to? And then kind of assistance starts to get carried out in terms of whether it's like trucks coming in with food assistance, or what we're increasingly seeing now is integrated programming using cash transfers directly, which I think is something in Ukraine, 25% of aid is kind of targeted at direct cash transfers, meaning that households are assessed for need and then they get money directly. Because for some households, we're seeing it's a very mobile crisis. So some households need medical care, whereas others need fuel and transport to get to safety, where other households need education support. So it really varies as to what the agencies are targeting. And then there's the carrying out, and then there's the monitoring and evaluation. How do we need to shift? What needs to happen differently? And maybe if I can add, what's interesting about humanitarian aid, I think a lot of people think of it as just this direct delivery of goods and services, but it's actually much more, right? If you scan the news, right, it's the advocacy to ensure what we call protection of civilians, right? Getting people out of harm's way, adherence to international humanitarian law, right? Fighting for civilian protections. It's also now things like, we're hearing all these incredibly devastating stories of women and children at the border, right? And being kind of abducted, or sexual abuse and exploitation that's happening. So the UN is really working on that. Like, how do we ensure the protection of women and kids when they come to the border to get to safety, right? How do you ensure that volunteerism and activities are done in a way that they don't put people in harm's way either, right? So I think that there's all kinds of things that need to happen on that. In addition to just the constant kind of relaying of information to the media, to governments that are supporting the humanitarian efforts with funding or different responses. So it's kind of, it's information, it's advocacy, it's delivery, it's assessment, it's all of these other things as well, which is, to my mind, what makes the field so exciting and so interesting, because there's so many components to it.
Yeah, and one of the things that I was thinking about, given the overwhelming needs of people across the world in these ever-changing crises, I would think that humanitarian organizations would need to perform these logistical feats, in order to serve the people in crisis. And, can you speak to that? Sort of what are those activities, and then who are the people that you need to have that know how to move all these things across the world? When things pop up and when need arises.
Yeah, I mean, I think that's why some people were like, oh, why are these large headquarters organizations, right? Or what are overheads? And is my dollar really going to get to the person who needs it? And those things are all really good questions and accountability. But to carry out global assistance in this way, you need a lot of activities that aren't just the delivery of a food or a direct cash transfer, right? So, because you need to do this monitoring assessment, you need to support governments and local actors to get that information. So, the logistics are huge. I mean, what's interesting is I would say over the last decade or so, it's gotten a lot more sophisticated in that, I would say the majority of humanitarian aid, there's kind of local procurement and action. There's a lot of thinking about how do we support local markets, right? And instead of shipping food, from the United States all the way over, what can be used locally. Now, some of this we're seeing as a little bit of a challenge. For those who are really following the Ukraine crisis, there's all these knock-on effects of what's happening. And one of it is really kind of wheat shortages. And because Russia and Ukraine produce so much of wheat, of the world's wheat, which is what the World Food Program relies on to support all these other countries that have food insecurity, we're seeing a real challenge there in that way. But I think that, there are still the crises where you need to be doing kind of these incredible logistics, boat, storage, transport, rail, trail. I mean, in Nepal, we use donkeys, right, to try to get to these remote areas, or we used the trekkers, right, who would lead kind of these trekking expeditions, because where the earthquake hit in Nepal was so remote. In the Haiti earthquake, we had massive challenges because the majority of the roads were complete rubble, as were the trucks and the fuel. So even if you could get food to Port-au-Prince, so the airport only had 14 working spots for airplanes, which is nothing when you're thinking about the scale of trying to get aid in. And even when you got the aid in, there were no trucks. And even if you got trucks, there was no fuel. And even if you had a truck of fuel and the goods, all the roads were filled with rubble. So how do you get things going, right? So this was an interesting issue, was like, within where all these displaced populations were in these camps. And, we're like, okay, well, we need water and sanitation quickly. So, someone donated all these latrines. Okay, great. Like porta potties. And you're like, great. But again, like getting the porta potty to the airport is one thing. Getting the porta potty to the site where 100,000 people are is another thing. And then you have to service those. So how do you do that, right? So very quickly, the humanitarian system has to think of what are other ways to do water and sanitation, right? And that's where kind of innovation comes in. So there were these, NGOs that were thinking about like, what are, compostable toilets, or are there systems of, using plastic bags? I'm sorry, this is kind of probably a little bit extreme for some of your listeners, but I think it gives you a sense of the type of innovation and response, and how sometimes from the outside you might be like, well, why don't we just do this? And it's like, well, here are all the challenges. So now I would say in the past decade, what's interesting is like cash transfers, right? You don't need this huge logistics that's quite expensive and complicated if things are available locally and it's safe for people to access them. Then it's so much better to deliver ATM cards and let people access funding as they need it. We can carefully register and monitor, all of those things. So that's kind of where I think there's some interesting examples of, how the use of kind of technology and new systems is supporting kind of the logistics infrastructure of getting aid to different people in different ways. But one other thing I think people might not think about in terms of kind of access, which is, I always joke with my students, I teach a large undergraduate class, and I'm like, a lot of the times, if I'm asking you, what is a challenge to this? The answer is access. And so the idea is that, a lot of times the humanitarian system, whether it's a national, local, or international system, has a really hard time getting access to people who need assistance. And I think in the US, we don't have that in the same way. So And it can be access vis-a-vis, if there's active violence happening, or sometimes because of that violence, there's checkpoints and the aid community is cut off from reaching those people. Or it can be governments kind of constraining access, right? Humanitarian aid is a resource, and it's a political one, even though its premise is to be neutral. And, the humanitarian system operates under this principle of neutrality and this principle of impartiality. Like, we're going to help the people who need it most, and we're going to help without taking sides, kind of like like an emergency room would, right? We're going to help if someone comes in from gun violence, the shooter and the person who was shot, like that's kind of part of the Hippocratic Oath. And so the humanitarian system has a similar principle level where it says, which is what distinguishes it from human rights and from the development system, which I think a lot of people don't necessarily, right? That there's always should be some sort of a global humanitarian imperative, a global response that has the right to give and receive assistance no matter who you are and where you are, that it should be some sort of a checks and balances on humanity, right? In this interesting way, which is, but sometimes governments don't want humanitarian actors in their country, either that can undermine their authority or that they think, it is a resource. And so like in Ethiopia, there's challenges now with the Ethiopian government and access to Tigray. It's also really, these are really complex environments. And so getting aid, and I know in Eritrea, you need to get, 10 days advanced, I think, permission to be able to deliver aid anywhere, which makes it hard to do emergency work in some ways. And then funding, right? There's only limited funding. And so that makes it really challenging also to get aid where it needs to go, which is why in general, the story of humanitarian aid is much easier to tell of it not working than where it is working, right? It's much easier to see and to point out the inefficiencies and inequities in the humanitarian system than to see what is working, because it's such a challenging thing to do.
Okay, great. Thank you. So I see from your CV that you have worked with the United Nations in various positions and capacities. And I think you've spoken a little bit to this, but can you give us, an understanding of where the UN fits into the work being done to serve those in a humanitarian crisis? It sounds like it's sort of a convener in many ways.
Yeah, I think it's all those parts, right? It's the assessment. It's, first, a crisis has happened. Can we get permission to have a global response in that place? And sometimes that's really easy, and sometimes that's really hard, and sometimes it's not needed. And then it's, well, how do we just support your government and what you're doing? Then it's assessing those needs, and then it's ensuring that, there's a broad community of support there, both local and international and national. And then it's, getting the aid in, and then it's doing the larger advocacy and the monitoring and evaluation. But, what's interesting is also when I first started in this field in the late 90s, the topic wasn't called global humanitarian aid. It was called like global emergency assistance. But now, because emergency, I think, indicates short term for so many people, in the average time that someone is a refugee is in a refugee camp is 27 years. That's the average, right? And the majority
wow.
Yeah, you think of it as these, yeah, there's some camps that have had generations of people living in them, right? And a lot of those crises in those 69 countries, right? Those are crises that have been going on for 10 years, like the Democratic Republic of Congo or Burundi, right? Or, so I think that there's, but yet the funding, because it is for life-saving, is still usually short-term, right? It's usually 6 months, 1 year, or 3 years. So it's an interesting mismatch of how do you achieve results with emergency funding. So it's kind of this, this challenge. And so that's a kind of another thing that the humanitarian system is doing, is like trying to assess how it does that. So now one of the big challenges is kind of climate change, right? We've always been on the response side of that. So it's very clear, right? We've better at floods and now extreme heat, which people don't think about, is one of the largest killers of a type of a crisis. That is kind of surprising to many, because you hear a lot about floods, but you don't hear about extreme heat emergencies. But that's something. So, what do you do in an extreme heat emergency, and what does that look like, and what kind of response systems can be set up for that? But with climate, it's also now, well, how do you do preventative or mitigated action, right, to So how is the humanitarian system what we call either like anticipatory action or predictive analysis? And so that's something the system is now thinking about. How do you use data and trend analysis to try to think a little bit more about, is there preparation versus just response that the humanitarian system can do with its limited budgets? So the full budget of all those 69 countries is 40 billion, is what the ask is. Realistically, yeah, it'll get around 40 to 50% of that. So maybe 20 billion if we're lucky. I think, but that might seem like a lot of money, but I think if you look at like what the US spent on Valentine's Day, I think it's about 20 billion, or St. Patrick's Day, or dog Halloween costumes. Like there's different statistics out there. Lawn care, I think, so I think you think of it as a lot of money, but it isn't a lot of money to support the life-saving needs of 1 in 29 people around the world. It always kind of like surprises me the challenge for that.
Yeah. So what are the different groups within the United Nations that are working on that? So there's obviously different pieces, and I'm just wondering what the names of those are.
You mean in terms of what United Nations agencies do humanitarian?
Yeah. So
it's the World Food Program, like I was mentioning before, WFP, right, who won the Peace Prize. There's UNICEF, the Children's Agency.
Okay.
There is UNHCR, which is the United Nations High Commissioner for Refugees, so the Refugee Agency. They're the ones leading in Ukraine right now. There is UNFPA, which is the Population Fund, but really looks at kind of a lot of issues around women and children. There is FAO, the Agricultural Agency, that really works in a lot of these food security crises, the World Health Organization. And so, UNAIDS comes in on certain issues, UN Women comes in on certain crises and issues. And then the organization that I worked for is the Office for the Coordination of Humanitarian Affairs. So that's kind of the UN agency that is kind of the lead of these, some of those organizations might argue lead, but like is the coordinator. So the way that I sometimes describe it to students is like, OCHA is kind of the president's office and oversees arts and sciences. And then all of the agencies are kind of, the Batten, the Darden, the law school, McIntyre, that kind of thing, more specialized. So it's not a perfect analogy, but I think it sometimes gives a sense of how these things work together.
Great. Thank you. And finally, can you tell us about your teaching and scholarship, sort of as the director of global humanitarian policy and the co-director of the UVA Humanitarian Collaborative at the Batten School? What are your goals, and tell us about, what you're working on.
Yeah. So I teach, I guess my goals are, I love kind of framing it that way, are, I really love my career and I love this field, and it's been incredibly interesting and fascinating to work on. And so for me, to be able to do this at Batten is really exciting, because I believe, and I just recently said that this at a kind of Batten board and alumni event, that, looking at these case studies on global humanitarian aid are so useful, I think, for public policy and leadership, because there's some of the most challenging public policy case studies, because there's not a lot of always data and evidence to use, right? They're very real, they're very complex, they're multifaceted, right? They involve everything from human rights to environmental issues to politics to cost. And then at the same time, from a leadership standpoint, right, they're really important leadership questions that the ethics are really challenging and the consequences and stakes are really high. So to be able to use those in a teaching environment, I think is, and also, the students are really aware of these crises. So I'm really lucky in that students already kind of come into the classroom caring about them. And so I also think that students recognize that, crisis is going to be a huge part of their future, whether they end up working for the private sector or the public sector, for government or a nonprofit, right? As we saw with COVID, there's no kind of industry or profession that this doesn't touch in some way at some point. So for me, teaching it is really great, because I do feel like I hope that I'm able to expose them to something that is really relevant for them, no matter where they go, and is really tangible. And then from the other side of my work, I would say that my main goal is really to kind of connect that practitioner academic divide, right? As a professor of practice, I try to kind of think carefully about how can I contribute the most to the university. And I think the way that I can do that is through the majority of the work that I do outside of the classroom is all linked with real-time challenges and partners who are working on these crises. So I still do work directly with the United Nations on response, right? So writing policy briefs, answering different questions, or I'll work with governments, work with the German government last year on how do we increase kind of mental health and psychosocial support for displaced populations with Amanda Wynn at the School of Human Development. And then right now I'm working with Professor Lucy Bassett on work with Sesame Workshop and Lego on how do we increase early childhood, like support specifically to kids under like 3 and 8, depending, and their caregivers in emergency situations. Like, what does it look like through the eyes of a 3-year-old, right? What is a refugee camp? What do they need in a refugee camp, which is different than basic services that we provide? So I kind of do try to work with different faculty around grounds and find an external partner who has a real-time question. And then we kind of merge our thinking and we hire students. And then we work together in these kind of intergenerational, interdisciplinary teams directly with practitioners. So most of my work is really like kind of 6 months or 1 year. It's also probably shorter than many scholarship projects because they're mostly kind of real-time challenges. And so then either we'll do everything from systematic reviews and kind of more desk-based research to kind of qualitative assessments and studies and consultations all the way through to kind of presentations and like kind of more public events, because in a lot of these spaces, the academic independence, right, the neutrality and the interdisciplinary is really exciting for these organizations. And then, also we'll do policy development. So they'll ask us to kind of help draft different new policies that organizations can use in these contexts.
That's great. The students really get to see what this whole field is about. And if it sparks an interest for them, as you're saying, hopefully they will continue and work with these organizations in the future. Right?
Yeah, we have. It's so fun now for me. This event that I mentioned earlier, this Batten alumni board event, all of a sudden there were like 30 students there. And, one came up to me, he's like, oh, I'm working for the Department of Defense. And they just asked me to help with their protection of civilians work, in conflict, which I really believe in. I remember we talked about in class. Or then I have another student, who works for the World Food Program for the UN, and she's in South Sudan right now. And then I have another student who's in New York, who's now the head of advocacy for Concern, which is which is one of the NGOs that's kind of working with the UN. And, it kind of goes on and on. And then there's students working locally, but still on crisis type issues. So it's really, it's very, very exciting for me to see what's out there and where they're going and building this kind of another community engaged in this space.
That's great. That's wonderful. Well, thank you so much, Professor Gelsdorf, for sharing this information about your work and your research. Right now you can't turn on the news without seeing these humanitarian crises unfolding before our eyes. So I really appreciate you sharing your knowledge and expertise about the humanitarian sector to share with our UVA alumni, friends, and family. So I really appreciate it. Thank you so much.
Yeah, thank you so much for having me and letting me talk about these issues. So I really appreciate it.
Great. Thank you. And thank you for listening. For upcoming podcasts and other Lifetime Learning programming, recordings, and blogs, please visit our website at engagement.virginia.edu/learn. You can also find our podcasts on Spotify with the Virginia Audio Collective, which is a network of UVA podcasts hosted by WTJU Radio and can be found at virginiaaudio.org. So thank you again, and we look forward to you taking part in future Lifetime Learning programs.